Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Craniotomy codes and differentiating how they apply to brain tumor surgery versus evacuation of hematomas. On the second slide, I have outlined how we will proceed through this 50 minutes. We'll first go over an update of new ICD-9 codes in 2011 and 2012 that are applicable to cranial surgery. We'll also review some of the CPT changes in 2011 and 2012 applicable to cranial surgery. We'll talk about the principles of cranial coding that will provide you with a format to review an operative note and look for the primary and secondary components that may be included in a particular procedure. I'll review some of the hematoma and tumor codes that are pertinent to this talk, and then finally we'll go through a few coding scenarios as examples of what we've learned. There were CEU questions prepared in advance, and you should find them fairly easy to identify their answers as we move through the conference. On our third slide, we have 2011 ICD-9 changes, and schwannomas, which are tumors of nerve sheaths, are found both in the cranial area as well as the spinal area and along peripheral nerves. And one change that occurred was defining a broad distribution of schwannomas called schwannomatosis with the 237.73 ICD-9 code. And then, as in many of the ICD-9 codes, there's an other category or miscellaneous category which was created. In 2012, on the next slide, postoperative shock was the primary new ICD-9 code that's really pertinent to all of surgery especially if dealing with cranial hematomas, patients often have significant other injuries and can develop hypovolemic shock or cardiogenic shock, and it's helpful to understand and utilize those ICD-9 codes when that impacts on the surgeon's treatment. Hematomas can sometimes be a consequence not just of trauma, but they can be a consequence of aneurysmal rupture as well. So I just listed some of the new cerebrovascular ICD-9 codes of unruptured aneurysm and absence of brain artery as a reminder. Moving on to our fifth slide, for 2011, there were CPT changes that essentially separated out neuronavigation. It was formerly described with code 61795 and applied to both cranial and spinal problems, but this was changed to specify cranial extradural problems, cranial intradural problems, and then spinal problems, each with their own specific codes. So for most of what we will be discussing, 61781, if there is an appropriate additional procedure of stereotactic navigation performed for an intradural process, whether it is a hematoma or more commonly a tumor, then the 61781 code would apply. There are some circumstances with skull-based tumor codes in which the tumor is actually in the sinuses of the face, and so there may be circumstances where the cranial extradural navigation code 61782 would be applicable. On our sixth slide, I wanted to briefly review the principles of cranial coding. I typically teach a similar schematic for spinal coding, and the difference between cranial and spinal coding is that there's generally only one principal code for cranial coding, and that's going to be the craniotomy code. A subtle exception would be for the skull-based surgery codes, which we'll talk about in a little bit, in which that has been subdivided into an approach code and a definitive procedure code. Other than that, most of the time craniotomy codes will stand on their own as the primary procedure, but there are many add-on codes that can be considered in cranial procedures that one should look for in an operative note. They would include things like microdissection, navigation that we just talked about. Some surgeons, when they remove certain types of tumors, will place a lumbar drain in the back to reduce the risk of cerebrospinal fluid leak. Ventriculostomy can be placed at the same time.
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.